Welcome to the Tennessee Community Engaged Alliance Against COVID-19 Wellness Wednesday show, also known as TNCO Wellness Wednesday. I am Dr. Katherine Y. Brown, your host. Now more than ever, we must stay informed and stay engaged about the COVID-19 pandemic in Tennessee. Our communities, Nashville, Memphis, and surrounding areas must increase our understanding of the factors that contribute to the disproportionate burden of COVID-19 in underserved communities of Tennessee. Throughout our conversations on this show, we have been introducing you to thought leaders that are establishing effective community engaged strategies that are aimed to increase knowledge, awareness, testing, and vaccine readiness as they begin to address structural inequities and COVID-19 disparities. It is with much excitement that today I introduce you to Dr. Aima Ahonkhai. I am so sorry. Assistant Professor of Medicine, Division of Infectious Diseases, Vanderbilt Institute of Global Health. Dr. Aima, I was so excited to get to all of your accolades. I was going so fast because I'm just so excited to have you here with us. You are doing so much in the community as it relates to COVID-19. I just couldn't wait to hear from you. So welcome.
Thank you. Thank you so much. Yeah, my name is a little tough, so that's fine. It's Aima Ahonkhai.
I have it written down.
Yes. So I'm very happy to be here.
We have you here. Now, first, before we get into all of the things that you're doing with COVID-19, can you just tell our viewers a little about yourself and some of your amazing accomplishments? Because I've read your bio and we would be here a long time if I went through it, but just introduce yourself to us and tell us about some of those accomplishments.
Sure, no problem. So as you mentioned, Aima Ahonkhai. I'm a medical doctor trained in internal medicine and infectious diseases. I did my training at Johns Hopkins in Baltimore, then at Mass General in Boston, and I joined the faculty in infectious diseases at Vanderbilt in 2016. And so since I've been here, I take care of patients with infectious diseases. My practice is primarily patients living with HIV and AIDS. And my research, I'm a physician researcher, has focused really on improving access to treatment for people living with HIV and making sure people get on their medicines and stay in care, both domestically here and around Tennessee and globally as well, particularly in sub-Saharan Africa. And then, of course, as an infectious diseases physician, we have all been kind of called to duty during this pandemic to play a part in various ways. And so for me, that has looked like been several things. One, because I am my research is really considered public health research, and a lot of the challenges we see in HIV care, we can use parallels to think about how to address them for COVID-19, whether it's testing or vaccination. Also, taking care of patients in the hospital is a part of that. But I think for me also as a minority physician, education and advocacy has been an important part of what I believe my mission and responsibility is as well.
Absolutely. So you mentioned your work with COVID-19. So I want to kind of transition there and have you tell us a little more about the work that you're doing with the COVID-19 and vaccine readiness in the community.
Sure. So I am on the Tennessee SEAL team that's led by Dr. Paul Juarez at Meharry. And they've gotten support from the federal government to really work with communities across Tennessee, as you know well, to provide education, outreach, advocacy, and access. And to really think about what are the most novel ways we can do that by bringing together teams in different parts of the state who are already actively engaged in these areas and committed to reaching vulnerable populations, especially minority populations. And so this is even a part of that, making sure we're providing education and opportunities to have conversations with people, answer their questions, and really make sure people have access to accurate information.
Absolutely. And so, because you work in the Division of Infectious Disease, the question that we always get is how can we keep ourselves healthy against the COVID-19 virus? To that question, what would you say?
Yeah, so I mean, I think the first thing is that, and this may sound a little bit on repeat, but I just want to make sure everyone is clear on this message. Obviously, this is a respiratory virus. We know it's spread through respiratory secretions, through our airways. And we know that the things that can protect us are masking, social distancing, and now vaccination. In our minority communities, we know that the risk of getting infected with coronavirus is higher, and the risk of getting hospitalized is higher, and the risk of dying is higher compared to white individuals. So with that increased risk at each step, it's always important to me to emphasize that we need to make sure we are protecting ourselves, our communities, by taking the steps that are available to us. And right now, those are the ones that we have, really: masking, social distancing, and vaccination.
So the last thing you just said was vaccinations. How should communities get vaccine ready, or what should communities do to get vaccine ready? Because I know we keep saying vaccine readiness, but a lot of people watching might not know what should the communities do to actually get vaccine ready.
Right. I see my role as an infectious diseases physician of color to provide information. And, I want my patients, my family, the people that I'm advocating for, to feel empowered with information to make decisions that are best for them. While it's very clear that we can't get back to any kind of normal in our community without a fair amount of people getting vaccinated, we also have to make sure that people feel that there is choice, because there is choice. You can't force anyone to do anything. So it starts with making sure you get questions answered from a reputable source. And there are a lot of, there's a lot of misleading information out there about coronavirus vaccines. And so going to reputable sources, going to your physician, tuning into, webcasts like this, going to websites like for Tennessee SEAL or for the CDC or for Tennessee Department of Health. Those are all reputable websites. I'm at Vanderbilt. We have our own VUMC coronavirus page to really get your questions answered, I think is critical. So readiness to me is making sure that you have factual information, making sure you understand what your risk is and what the benefit is to you, because there's no choice that we make in medicine, whether it's coronavirus vaccination or anything else, that doesn't have a risk benefit ratio. Mm-hmm. And, for me and my own decision, there's a risk benefit to me, there's a risk benefit to my family members, and then there's community. And so in making that choice for myself, I considered all of that. And the benefit far outweighs the risk when I make that calculus. And I want to make sure people have the information to make that decision for themselves, hoping that we also keep the public health benefit in mind as well.
And you raise an amazing point that I don't know that people hear enough of, that the benefit outweighs that risk. So I thank you for sharing that. And also that there are educational forums like TNCL Wellness Wednesday, the TNCL website, that are trying to share information to communities in a timely manner. So speaking of community, in your own words, what does community mean to you?
Well, community to me, I think if you asked me this before coronavirus, would it be the same? I would hope so. But I think right now, community, because we're still lacking in touch and reaching each other and seeing each other, it's my family, it's my friends, it's my patients. Very much right now, community is people who look like me, and thinking about the wellness and wholeness of people who look like me, facing not only the health challenges, but all the other social challenges that we're dealing with in the United States right now. Yeah, so for me, it's family, it's friends, it's my patients, and it's the people who look like me, whose experiences I can very much resonate with at this time and in this place, the place where we are right now in the United States.
Mm-hmm. So kind of as we get ready to kind of summarize here for today, I want to make sure that people hear this from you. You've talked about a lot of this, but I want them to get this takeaway. Mm-hmm. How do we maintain health during a pandemic? Health.
Right. So, I mean, I think we know that the COVID-19 vaccines that are available are very, very effective at preventing symptomatic disease, or so disease where you actually get sick, get hospitalized, or the worst outcome we could imagine, which is death. Mm-hmm. These vaccines are nearly 100% effective at preventing those things. What I want people to also understand is that if we don't get vaccinated in our communities of color, the disparities that we all see and are so concerned about, outraged about, uncomfortable with, will only get worse. We're coming from a starting point where we're at least 2 times more likely to die from coronavirus as African Americans or people of color than our white counterparts. And if we don't get vaccinated at the same rate, that difference will continue to get worse. And so I think there's, like I said, there is a risk benefit to every choice. But I want people to know that these vaccines have been tested in a way that is very rigorous, that there have been no corners cut in the testing of these vaccines, and they are very effective at preventing getting sick or dying from coronavirus. So that's definitely something I want to leave people with.
Thank you. And it's so important to have someone like you who is on the front lines and you're doing research and you're doing patient care. So I want to say to you, thank you so much for your service and all that you do, because you're making a difference. And especially during a pandemic, your work is saving lives in a powerful way. I've asked you so many questions today, and you have just given us lots of information. But is there anything else that you would like to share on TNCL Wellness?
Yeah, I think that, this is a time where we are all advocates. And so, you asked the question also about how do we get vaccine ready? And I think sharing information is a part of that, but also telling your story and your example to people who know and trust you is a part of that. So for me, that is my patients, but it's also my family, it's my friends. And once you've had your own experience with the vaccine, if you can share what that was with others and reassure them based on your experience, I think that will also continue to be really helpful, because we trust the people around us. We trust the people in our communities. And I think that we all have a role that we can potentially play there in helping to advocate and getting us back to a normal that we can recognize safely.
I love that. To get us back to a normal that we can recognize safely. Dr. Aima, that should be on a shirt somewhere. Well, I want to thank you again for joining us for TNCL Wellness Wednesday. For our viewers around the world, I invite you to join me next Wednesday. Come back here again for TNCL Wellness Wednesdays. You will be meeting amazing thought leaders, researchers, and content experts, just like Dr. Aima Ahonkhai, who is an assistant professor of medicine, today with us on here from the Vanderbilt Institute of Global Health. Here's the reality. You won't want to miss an episode, so be sure to share this message. Until next time, stay informed, stay healthy, like, share, repost, and share this message with your community. Until next time, I'll see you next Wednesday.
Thanks.